What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for the viruses. It is time now for the Saturday edition of the Virus Update for Saturday, October 4th, 2025. That's right. It is the first Saturday of October. Can you believe it? Hey, if you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there. You need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news, data, information, and anything I can find to help keep you safe and informed of what's going on with these viruses. Want to stay informed? Subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Alrighty, would you believe it? Without CDC data, and sadly we do not have CDC data today, we have a ton of things to show you. Yes, the news portion of this video, wait until you see how long it is going to be today. Then we do have some data on a state level from CJS, so we will get to that as well, and a few other things in between. But first, like always, starting off with the news and posts that I find on X. Italy, this is some news. This is actually some data. Italy, COVID cases from Dennis, the COVID info guy. Their COVID cases there are still rising. Would you believe it? Yeah. Hopefully they see a peaking soon. Hopefully the UK sees a peaking soon. And all these different countries in Europe that are still rising. This data is from September 18th through the 24th. The positivity rate there is 12.8%. That only went up by 0.1%. That's a small increase. That's kind of encouraging. Maybe that's telling us that things are going to slow soon, but reported cases went up by 4,000, or reported cases were 4,256, and went up by 15.2%. So, still a big increase in cases, not a big increase in the positivity rate. Hopefully a sign that they're going to slow and then drop soon. Deaths, that went up by 76.1%. They added another 37 deaths there. And I always like to remind you, when we get death information from anywhere, that yes, people, even in 2025, are still dying from COVID. And I know right now someone's getting ready to post down below, oh, it's the ones who took the vaccine. No, it's some people still die from COVID. And it could be vaccinated, unvaccinated, much less likely with the vaccine, but it does still happen in all types of people. Alright, taking a look at variant sequencing. XFG is 78% of the cases there in Italy, and XFG.3 is 12% of the cases. And one thing we do not see reported about there, which is a good thing, BA.3.2. I do have a sticky note about that. We are looking to see if that pops up in more countries. We're hoping it does not become the dominating variant for the wintertime in the northern hemisphere. If it does, we're going to have a problem. We're going to have a problem if that starts to go dominating around the world. All right, moving on now to this. I believe we are in Canada this time. Yes, COVID-19 outbreak declared at Cambridge Memorial Hospital. This is not a good thing at all. In a press release, the hospital says 2 patients were sick in Wing A of Level 3. A hospital outbreak is declared when 2 or more patients and or staff test positive for an infectious illness that was acquired in the hospital within a time frame that is consistent with epidemiology of the disease, and when there is a link between the cases. So, yes, there's an outbreak going on there. As we know, COVID in Canada has been for the longest time listed at medium. I don't know, maybe that just stopped updating. I honestly don't know. Maybe it's at high now, maybe it's at low, but the fact we are seeing a outbreak in a hospital tells us it is still circulating there. Now moving on to this from Glador. COVID in England. Weekly A&E attendances for COVID-like illness in England. Data to week 39 ending September 28, 2025. The weekly total for week 39 is 22% higher than that for week 38. The level in week 39 is the highest since week 42 of October. Week 42 of 2024. I'm saying October, but I'm not actually seeing the month that it was. But you can clearly see here, it's been trending higher. And the thing I've noticed with COVID waves, not just in the UK, around the world, when we start to see these faster rises like we're seeing right now, it's usually maybe a sign that the peak is coming soon, with exceptions to the case of BA.1 back in several years ago, back when we had the initial Omicron wave. But it's usually a sign that things maybe will be peaking soon. I'm hopeful because this has been a very long wave in the UK. And as you know, I've said before, these longer duration waves, that makes the period of time when people are, makes the period of time of high risk last longer because you're dealing with longer periods of higher transmission of the virus. All right, here in the United States, Los Angeles reports COVID hospitalizations are higher. Yes, I'm going to repeat that. Higher than last year, and COVID positivity is higher than 2021 through 2024. That's not good. Year over year as of September 27th, and, well, here's part of the reason for it. One, the COVID wave was later this year. Two, the positivity rate is so high because a lot of people are just not getting tested these days, and that really is a problem. All right, moving on. More from sci-fi. Breaking, this was as of yesterday. Breaking, California reports the Bay Area has record high for the 9th consecutive week COVID positivity, 6.2% year over year. Statewide, LA and Southern California are higher than last year, 6.7%, 6.4%, and 6.3%. And, well, again, not as many people are getting tested for COVID as of last year. And when less people are getting tested, the positivity rates during waves end up being higher because we're not finding as many of the cases. All right, moving on to this from Mike Horger. A limited PMC report will post on Monday. Biobot has updated. A key advantage of using two main data sources, Biobot and CDC, is the capacity to post updates when one is offline. And yes, you might have heard me mention it yesterday. There's no CDC data. I mentioned at the beginning of the video. It's because we're in a government shutdown here in the United States. Until that is over with, I don't know when we're going to see CDC data once again, and if it will come on the time it's supposed to come, or if it'll just update at a random time when things reopen, which, honestly, at this point, we don't know when we're reopening here in the United States. They're not even in Washington trying to reopen us right now. They went home for the weekend. It's totally ridiculous. They had a vacation. They went back to do a vote yesterday. They went home for the weekend. I mean, yes, the United States is such a mess right now. Moving on now to this. Older COVID-19 survivors more likely to develop new onset dementia, study finds. We've heard this before. Just reading the headline for you. Adults 50 years and older who survived COVID-19 had higher chances of developing new onset dementia compared to those who were not infected, according to an October study published in NPJ Dementia. And let me tell you something about that. Compared to those who were not infected, that's not many people at this point. No, there's still some Novids out there. Novid meaning you have not had COVID. Yeah, there's still a few out there, but that number continues to drop with each wave. It's oh so sad. COVID-19 infection associated with increased, yep, we just talked about this, so no need to talk about it again, but you get the idea here. This study is from the UK, by the way. That's where this data is coming out with dementia. Didn't realize I had put that up there twice. All right, now taking a look at this. Person infected with measles visit two public places near New Albany, officials say. This is in Ohio. I didn't even need to look that up. I knew that because I've been to this area of Ohio. I have a lot of relatives out in Ohio, this being a Columbus area. Columbus Public Health and Franklin County say that, yes, there is a person with measles visited New Albany. So we've been seeing measles pick up the pace once again in the past week. We've had a lot of measles news stories lately, so this is not good whatsoever. And then now moving over to Mississippi. I told you, it's a busy news day. A baby in Mississippi dies from whooping cough. Yes, an infant has died from whooping cough. The Mississippi Department of Health confirmed, making the state's first pertussis-related death in more than a decade. Yeah, that's not a good thing whatsoever. And now moving on to this in Kentucky. One death confirmed from West Nile virus in Daviess County. Yes, the Green River Green River District Health Department has confirmed one death from West Nile virus this year in total. 5 cases have been reported in the district, with one death in Daviess County. Henderson County has also seen, let's see, three cases in Daviess County, including the one death, and 2 cases in Henderson County. So 5 cases and 1 death there. Now moving on to this, tuberculosis. Case reported in Lake Norman area high school. What to know? Yeah, this is not good. Health officials in Charlotte, being North Carolina, Charlotte area are investigating a case of active tuberculosis at a local high school, and we've been seeing a lot of cases lately of tuberculosis pop up, and I'll have to see if we have this in the tracking thread. We did add a few things. Like, I thought we added something for North Carolina. I don't know if this is the same high school. I'll have to go and check the thread. I mean, when you have, what do we have, well over a dozen tracking threads, it's hard to keep a track in your mind of how many different things you're keeping an eye of. It can get confusing after a while. But yeah, they say they're working with state and local partners to identify and notify anyone who may have been exposed to the bacteria. And as we have learned, you may remember a Michigan case earlier this year, you can go a really long period of time after exposure and become infected with TB. So this is something we are going to be continuing to keep an eye on. Now, moving over to New Hampshire. If we can get this story to load, it looks like it has froze. Okay, well, it's not coming up. In New Hampshire, yes, there are new cases of tuberculosis as well in the Manchester area. So, yeah, that's something to be mindful of as well. All right, moving over now to this. We talked about it yesterday. I'm going to bring it up again. We do have the final results of that poll we took. If you had COVID, if you returned to the way you felt pre-COVID, for those who have not had COVID, I will post updates in the comment. 28.2% said yes, and 71.8% said no, and that is out of 1,852 votes. That's the most votes we've had on a poll in a very long time. In recent memories, we've had polls go that big or bigger, but it's been a while since we've had one go that big, and we've seen all kinds of different problems show up. Some people said they have a cough that doesn't go away. Hey, I can raise my hand to that. Seems like now that we switched in the fall, you may even notice it in my voice today. My congestion has been picking back up again, but I think there's another reason. Those who follow the channel long enough know I'm supposed to get injections. Haven't been getting them for a while because of insurance. We're not going to go down that road again because of insurance issues right now. I don't know when that injection is going to be resumed. Hopefully, eventually it will, because I was thinking I could lean off of it, but I don't think so. My breathing problem, that seems to be a little bit better, but now the coughing problem seems to be coming back to me once again. I mean, this past week has just been horrendous. All right, moving on now. Let's take a look at what's going on with air qualities in the United States, shall we? We're skipping over bird migration. Maybe we'll take a look at that tomorrow. Bird flu, as you know, continues to be a risk now, and it's been popping up once again. Look at the air qualities here across the Great Lakes. Down to the south, even a little bit of bad air quality here. Maybe that's part of my problem today. Taking a look at the West Coast, you can see California, Oregon, some issues still going on there. California, we can see a few yellows, but down here, you get down near Bakersfield, California. We got to really zoom in to see this. We do see some higher values there. So that is not a good thing whatsoever. All right, let's take a look at Pinellas County, Florida, for EMS calls. Before we do that, let's pause and take a hydration break. My throat needs it, and who knows, maybe you have forgotten to drink a glass of water. And you should. It'll help keep you hydrated. Excuse me. I'm telling you, I'm really congested for some reason. All right, taking a look here. We do see sick person listed 1, 2, 3 times it is showing up here. But again, this is nothing like what we've been seeing in the summertime. Philadelphia, do we have anything yet? I don't know. Let's see. Probably not. No, it's still saying Thursday. On the weekends, they tend to update later. That's why sometimes you don't see me show the Friday numbers until Sunday, and then the Saturday numbers until Monday, or in some cases both on Monday. All right, moving on to what's going on in Montgomery County, Pennsylvania. Hopefully not too busy. I am seeing a few things here. A stroke, cardiac emergency showing up a couple times. Also seeing respiratory emergency. Now taking a look at what's going on in Chester County, PA. And I'm not too busy. We do see EMS standby showing up a couple times. We also see stroke, 3 different fall calls, and 1 respiratory emergency calls. Still not showing Bucks County because I don't know what the deal is. Sometimes it works, sometimes it doesn't work. I'll have to look. Is it back to working again? I honestly do not even know. Taking a look at the hospital situation in Pennsylvania, which has been busier, today is not as busy. You can see here, just 2 hospitals in the Lehigh Valley. 1 up near Scranton. I don't know if that is updated. No, it's saying the 29th of September. You get the picture here. Not as busy today. So that is some good news. Taking a look at the hospital situation in New Jersey, and I'm going to refresh this. Seeing here, AHS Overlook Medical Center has a specialty issue. Also a specialty issue at Inspira Center Mannington. And yeah, that is it for New Jersey. Moving on now, let's take a look. This is where New York State reported yesterday. 681 positive COVID cases. And then we also see, when it comes to hospitalizations, that went up ever so slightly. But again, they're down from their peak. 451 and 45 people in the ICU at this time. Alrighty, finishing off today's video with some data from CJS. This will probably take about 4 or 5 minutes to read. Starting off with some data from Thursday. Obviously, I have a note here saying the CDC did not update this week. So most of his data here is state-reported totals. Thursday daily numbers. Florida, 481 new cases and 16 new state-reported deaths, including 1 from 2024. New York, 844 new cases. Puerto Rico, 206 new cases. Thursday, weekly numbers. Alaska, 210 new cases. Arizona, 1,055 new cases. Colorado reported 181 new positive tests and a test case positivity rate of 6.62%, down from 8.48 last week. Connecticut, 1,117 new cases. Hawaii, 229 new cases and a test case positivity rate of 5.4%, down from 6.1% last week. Idaho, 411 emergency department visits. Indiana, 668 new cases. Kentucky, 237 new positive tests. Massachusetts reports a net of 1,402 new cases and 11 new state-reported deaths. Minnesota, 1,007 new cases and 8 new state-reported deaths. New Mexico, 2-week update, 806 new cases. North Carolina, 496 hospital visits for COVID-like illness. North Dakota, 97 new cases. Oklahoma, 397 new positive tests and a test case positivity rate of 5.8%, down from 7.8% last weekend. Hold on 1 second. We got to take another hydration break. Throat's really getting clogged up for some reason. Friday, Florida, daily numbers. 415 new cases and 22 new state-reported deaths reported today, and 3,046 cases and 93 state-reported deaths reported over the past 7 days with what was reported today. Florida has now exceeded 2,000 state-reported deaths in 2025. 2,000. So for all those that think, oh, COVID's over with, oh, it's just the vaccinated. Well, you know, there's a lot of unvaccinated people in Florida. Florida has 2,000 state-reported COVID deaths in 2025. New York, daily number on Friday, 704 new cases and 4,968 cases reported over the past 7 days, as well as 19 state-reported deaths for the week of September 21st through the 27th. Puerto Rico, 153 new cases reported today, and 1,152 cases and 3 deaths reported over the past 7 days. All Puerto Rico deaths for this week were reported on Monday. California, a weekly number, 4,435 new positive tests, a test case positivity rate over the past 7 days of 6.81%, down like an anvil from 9.22 last week, and 46 new state-reported deaths. Illinois, a test case positivity rate of 4.9%, down from 5.5%. Louisiana, 639 emergency department visits for COVID-like illness, a test case positivity rate of 4%. Hey, that's down from 5% last week. And 7 new state-reported deaths. Nebraska, 145 new positive tests, a test case positivity rate of 8%, down from 9.4% last week. Rhode Island, 82 new positive tests and 3 new state-reported deaths. Texas, weekly cases, 1,955. West Virginia, 326 new positive tests and a test case positivity rate of 7.54%, down from 9.47% last week. Wisconsin, weekly case number, 714 new positive tests, a test case positivity rate of 7.2%, down from 8.6% last week. Alrighty, that does it for today's virus update for me and my congested voice. Sorry about this. I hope you enjoyed today's video. If you did, give it a thumbs up. Subscribe to my channel down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. Ways to support the channel are listed down below. I will see everyone again next time, which will be tomorrow on Sunday. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.